I don't think it would be possible to overestimate the amount of patience, effort, and self-control a caregiver needs in order to care for a person who is living with Alzheimer's or another dementia-related disease. It is incredibly difficult because, as you well know, we will never have any control over the progression of the disease or the impact that it has on our care receiver. In truth, there are very few things over which we will have much control, except for our attitudes and our responses. I think it's really important to recognize that it takes more than a desire to keep our cool under very trying circumstances. We also need a series of action steps that can help us decrease our care receiver stress as well as our own, so that we can avoid conflicts and power struggles that escalate into angry battles for control. So, if we can accept that the disease is in control and that our person is not intentionally trying to upset us, perhaps we can blame the disease for their outrageous behaviors rather than them, and that might be a great place to start. So then the next step would be to see if we can identify which events, situations, or individuals may be triggering their stress. They may not be able to tell you if they are experiencing some sort of discomfort. So this is where you will have to become a bit of a detective. You might want to touch different parts of your body to help them understand what you mean when you ask questions such as, "Are you hungry? Would you like something to eat? Are you thirsty? Do you need a drink?" If they're tugging at an ear, you could ask, "Is your ear hurting?" or "Is that too loud?" If you notice something odd about the way they're walking, you might want to ask, "Does your foot hurt?" And then maybe you should check inside of their shoes. Are they wearing them on the right feet? Is there something in them like a Lego or a bottle cap? Or maybe they're wearing somebody else's shoes instead of their own. Are they going to the bathroom a lot? Have you seen them hunched over or grimacing like they're in pain? If so, be sure to ask, "Does it hurt when you pee?" If they say that it does, get them tested for a UTI immediately. You can buy home test kits in most pharmacies for $10 to $15. And if it doesn't appear that they are having a physical problem, try to determine if something happened that upset them, hurt their feelings, or made them feel angry or scared. If you notice that their behavior changes as the sun is setting, close the curtains and the blinds, turn on the lights to prevent them from being frightened by seeing shadows on the wall that they can't understand. And then take a look at how you have responded to them throughout the day. Have you felt impatient, or have you argued with them or scolded them? If so, don't judge yourself too harshly, but do be aware that they are hypersensitive to other people's feelings. So if you are tense, nervous, and angry, they could very well pick up on those feelings and respond by being tense, nervous, and argumentative themselves. So let's take a look at a couple that we're going to call John and Tina. John has Alzheimer's, and when he wakes up one morning, Tina tells him, "Get dressed." And when he comes out wearing a Hawaiian shirt and shorts, Tina has a fit, and she says, "John, look out the window. It's January. There is a foot of snow on the ground. You cannot wear a Hawaiian shirt and shoes. You will freeze." And John responds by saying, "I'm not cold." And then Tina says, "But you're inside now, and you have a doctor's appointment in an hour, and you have to wear long pants and boots and a warm coat." And John says, "I don't want to." And the fight is on. So Tina forgot that you can never win an argument with a person who has dementia. So they both get stressed out and angry before they even make it to the breakfast table. So let's talk about how she might have handled that differently. Instead of telling him to get dressed and expecting him to make a good decision about what to wear, she could have offered him a choice between two things that would have been acceptable to her. She could have put out a pair of trousers along with a blue shirt and a gray shirt, and she could have asked him which shirt he would like to wear. And if he didn't like the choices she offered him, she could have tried another shirt, or she could have tried bribing him with something that she knew he would say yes to and be excited about. She could have said something like, I thought it might be fun to drop by Starbucks and get you a cake pop after we see the doctor. Would you like that? And when, of course, he says yes, she could just say, great, all we need to do is get you dressed. So the National Institute on Aging has a list of very practical, helpful suggestions that I think make a lot of sense. And they start with getting outside every day for a walk, if you can. If they aren't mobile or if the weather doesn't allow, try to go for a ride in the car. At the very least, have them sit next to a window, because exposure to bright light can help reset their biological clock, which could help them fall asleep and stay asleep at night. Engaging in some kind of exercise or physical activity will help them burn off excess energy. Taking a nap during the day can be a great way for both of you to relax and hit the reset button. And just be sure that you limit the length and the number of naps that they take. Short naps early in the day are much better than long naps late in the afternoon. When they are at home, try to eliminate clutter, limit the number of people in the room to lessen the noise and the confusion, reduce caffeinated drinks and avoid alcohol, which of course leads to increased confusion and anxiety. And if they become agitated, listen calmly and try to reassure them that everything is okay. And then maybe distract them with their favorite snack or get them engaged in activity. Ask them to help you fold napkins or washcloths, or play soothing music and ask them to dance with you. Read a story. You turn on the TV, just not to the news or anything violent. Call a friend or a family member who will talk to them. Whew, yikes, that is a long list, isn't it? Doing all of that takes a phenomenal amount of time, energy, and self-control. And you need to be aware that you are just one person. And for you to be able to do this over an extended period of time, you are going to need some regular breaks. And this is when it's really important to see if you can get them involved in a respite daycare program where they can be away from you and with other people who are having fun, laughing, singing, doing art projects. And those things could really make a difference, because they won't be getting in trouble with you for asking the same question over and over. They won't be getting scolded or stressed because they are creating a mess or doing something dangerous. So while they are having fun, you'll have some time to yourself to do whatever you need to do to rest your body and your mind and rejuvenate your spirit. They'll have fun and they'll be tired when they get home, which might reduce their behaviors and make them tired enough to sleep. Then if you've tried everything and nothing is working for you, call their doctor. They may need medical help. Nothing will stop the progression of a dementia-related disease. But if you can become aware of the triggers that cause them to experience stress that leads to challenging behaviors, perhaps it will be a little easier for you to figure out how you can make some changes to their routine, their environment, and the way you respond, so both of you will experience less stress during the day and fewer challenging behaviors associated with sundowning late in the afternoon.